Okay, well, let's see. Since all our panelists are here, when we have a nice full house of 45 people already, I think, why don't we go ahead and get started? For those who don't know me, welcome to all. And those who don't know me, I'm Dan Graff. I'm director of the Higgins Labor Program at the University of Notre Dame. I want to welcome you to this first in what is hoped will be a series of meetings called the Workers Forum, Conversations on Workers' Rights, Resources, and Roles During the Pandemic and Beyond. So again, thank you for joining us this evening. This event will be about 75 minutes, although I will stick around for another 15 minutes for informal conversation for those who'd like to. Of course, you can leave at any time, but I did want to let you know at the outset what the schedule is. I'll get to introducing our panelists and discussing the format in a minute. But as people are signing on still, I wanted to do a bit of an introduction so you have a sense of where we're coming from and why we're organizing this event. So the coronavirus pandemic has upended our world, including the world of work. For some, it has meant continuing to work, but from home, people like me. For others, it has meant continuing to work at the same location or locations they worked previously, but under very different, often very different circumstances and perhaps unsafe circumstances. And then for still others, the pandemic has meant not continuing to work due to being furloughed, laid off, let go, or simply in a position where you might have been self-employed and you don't have any work at the moment. But all folks, no matter what their work situation, have been impacted, even if quite differently. And that includes not only paid work, but also unpaid work, right? The pandemic, if you throw in the unpaid work of childcare with schools closing and the like, even that part of the work world has been upended. So lots and lots of questions have come out of this situation. We're in the midst of it now. We are certainly not past it. And beyond that, it's not like the work world was a paradise in the United States before the pandemic came. Yes, we had the lowest unemployment rate, at least officially, in a generation on the eve of the pandemic, but that says nothing about the quality of jobs that Americans were holding. And too many of those have been low paying, without good benefits, and without future opportunities. Finally, the racial disparities in income, wealth, access to quality healthcare, and economic opportunity were all a crisis before the pandemic. And that pandemic has only exacerbated many of those racial disparities. According to CDC, Center for Disease Control numbers, the age-adjusted hospitalization rate for African Americans and Latinos based on for COVID has been over 4 times the rate for white Americans. And in terms of just cases, not just hospitalizations, but cases as a whole, 3 to 4 times the infection rate of white Americans. So in short then, we have intertwined and pre-existing labor and racial crises that have now been amplified and in many ways worsened by the public health crisis we find ourselves in. Trying to make sense of where we find ourselves and creating a space for conversations on workers' rights, resources, and roles during this pandemic and after was the motivation for creating this Workers' Forum. And again, I'm hoping that we might start doing these as monthly meetings, live and online for the time being, featuring different perspectives from diverse panelists. And tonight we'll hear from a diversity of panelists, 5 of them. I'll introduce them as a group, then I'll ask each to speak for about 5 minutes, and then we'll have plenty of time for question and answer and discussion. During their presentations, I encourage the audience to use the chat function here in Zoom to pose a question for either a particular panelist or the group. My colleague, Katie McCauley, who is joining us. Katie is the Assistant Director of Communications at the Center for Social Concerns, where the Higgins Labor Program is also housed at Notre Dame. Just sift through the questions and call on and unmute particular individuals to speak. Otherwise, we'll all be muted except for the speaker to make sure that sound doesn't get distracting and this will go smoothly. So as I said at the outset, the formal program will run till about 7:15. I'll announce the formal close, but then invite folks who want to stick around to be unmuted and have a bit of casual conversation and maybe talk about future topics and maybe future panelists. We are recording this, so, and we'll share it tomorrow, I think, hopefully, as early as tomorrow via the Center for Social Concerns and Higgins Labor Program's Facebook page, Twitter accounts, and our home pages. So please, for those who weren't able to make it, you can share that. I'll email everyone who RSVP'd to this, the link to the recording if you want to share it or revisit it. And I want to thank everyone who helped with this. Judy Benchar is here helping with logistics too. Judy works at the Center for Social Concerns with me at the Higgins Labor Program. There are many others to thank who participated, but there are too many to name right now. Several of them are potential future panelists, so they'll have a chance to be recognized and to speak not long from now. Okay. All right, so let me introduce the panelists in the order that they'll speak, and then we'll call on each one. Again, they'll speak for 5 minutes or so, and then at the end of their 5 presentations, we'll turn to the Q&A. Our first speaker is David Niezgodski, who's an Indiana State Senator for District 10, as well as president of Niezgodski Plumbing, a union plumbing business established in 1922. He'll be followed by Brenda Buck, who's a custodian at Indiana University South Bend, as well as an officer in AFSCME Council 962. AFSCME stands for the American Federation of State, County, and Municipal Employees. Following Brenda, we'll hear from Karen Salzer, who's a representative for UFCW Local 700. That's the United Food and Commercial Workers representing grocery store workers, meat processing plant workers throughout, I think, Indiana and maybe Kentucky as well, but Karen can correct me later if I got that wrong. She'll be followed by Milton Smith. Milton is a home healthcare aide and a member of Service Employees International Union Healthcare. I think Milton is a native of South Bend, but maybe based in Indianapolis. But again, he will fill us in on his details later. And then finally, we'll hear from Robin Vida, who is Director of Health Outreach Promotion and Education at the St. Joe County Department of Health. So I want to thank in advance all the panelists, and we'll start now with Senator Niezgodski.
Okay, thank you, Daniel. I really appreciate the opportunity to be here today. This evening, I want to thank everyone for their attendance tonight and all the other speakers that are taking a part. What we are doing right now is absolutely essential because we are talking about those workers that are on the front lines every day in so many different modes of operation, those that are coming across they're risking their health, and they don't really have a choice, and they don't really have in almost all of the cases adequate pay to continue doing those jobs, and we have begun to recognize that in so many different ways. I also want to thank the Higgins Labor Program and the Center for Social Concerns tonight. And, you know, so in regards to our conversations, you know, we're going to be talking about the safety, health, and security, and then opportunities of how different ways we can move forward, because I do believe we're going to have to move forward collectively. Obviously, we should be seeing more from our federal government, but we have to ask more of our state, and we have to figure out how we as a community go forward and interact in a way that maybe we can call upon these different agencies to interact to the degree more so of what we need. You know, it was last night, I was kind of going through some different things. I was trying to maybe just try to find some different ideas of already what maybe some others had begun to utilize, but it was really, I thought it was striking because I came across, this is just a week ago, that, and this was an international forum, you know, so what some other countries have begun, at least some of the comments they're making. So, and this came from the president of Ireland, and it's the way it works out tonight is wonderful. His name is Michael D. Higgins. And he was speaking at the International Labor Organization Global Summit, but he made a number of comments, but this one here was very, very striking, and it speaks to the very essence of what we are doing here and what we have to do. And that's the opportunity. Our opportunity is that we have an opportunity to succeed if we all continue to do this together. But he said, and I quote, "How hugely regrettable it would be, what a lost opportunity if through some form of evasion or moral cowardice, we as a society were to continue a disregard for the efforts of these women and men, our essential workers, that having paid them a fulsome tribute for putting themselves and their families at risk for us all, we were to revert to where we were before this crisis." I just thought that speaks to the heart of everything that we have to do and stand for. And I've said it before in other forums. I'm here tonight because the only way that I can do a better job is through working with everyone in the community that is trying to have input and come up with the manners. We all have to be activists in our own right. And I stand ready in my part to begin doing the things as we step closer to when we get to session or we go to our summer interim committees on speaking up on some of these things that we're going to need. We cannot stand idly by and let this time pass. And we'll discuss this more. I'm sure to be coming up in some of the questions, so I won't go on too much further. But you know, I thought about this too when we're discussing hazard pay for these essential workers and things like that. I think we've got to look at it in a much longer viewpoint. Hazard pay are some things that they should get, but I think we need to be looking at it as we've always known. We need to be discussing about fair pay, because that is what they're doing every day. Just because we recognize that we have something here that does not have a vaccine right now, we're still exposing ourselves to these things each and every day. And they are working jobs that within our community, we absolutely essentially need them. And so I think we need to also discuss long-term how we are going to, just like in the quote from the president of Ireland, how we are going to go forward and recognize that we now, all of us together, respect in a much greater way the things that they truly accomplish each and every day.
Okay, thank you, Senator Niezgodski, and perfectly on 5 minutes. So he set a good pace for us. Now I'd like to ask Brenda Buck to speak. Brenda?
Hello, everyone. First, I'd like to thank Daniel and his staff for inviting me. You know, I'm here to speak on behalf of the essential workers. I work at IUSB, and we are very concerned. We're scared. We don't know what to expect, but IU doesn't either. So I don't want to put them on blast. You know, I'm not a person that checks my emails every day, but I have been checking them every day to see what's new, what they have decided. Is campus going to be open? Is it going to be closed? We're waiting to hear from Bloomington. You know, some days they have a plan, but then the next day that plan changes. And, you know, we feel that we're putting our lives on the line here to make sure that the campus is clean. And we want to make sure the campus is clean, not just for ourselves, but for the students that are coming there that provide, without them, we wouldn't have a paycheck and we wouldn't have a job. So, just, we want people to be considerate of us. Wear your mask, wash your hands. If you're sick, stay home. It's just a scary time, and I know we're going to make it through it, but just it's the fact of how we're going to make it through and what happens during the process of us making it through it. But we're on campus now. All facilities is on campus. We're trying to get the ventilation running properly. We're trying to clean the campus. We're ready for the students to come back. But yet, even though we're cleaning and we're preparing, it's still a scary time because you just don't know. And with IU being a public, campus, you can't tell this person or that person they can't come on campus. There's just so much, and it's just scary, but I know it's all going to work out.
Thanks very much, Brenda, for talking to us about that from your point of view. And I'm sure that we'll get some questions on the specifics of what's happening there in the Q&A. Next, I want to turn to Karen Salzer, who I just accidentally muted when I tried to unmute her. There we go. Karen from the UFCW. Karen.
Hello. Daniel, thank you for inviting me to speak tonight. And to all of those who have dialed in, thank you for being here also. The United Food and Commercial Workers Union, or the UFCW, is the largest private sector union in the United States, and we represent about 1.3 million professionals and their families that work in grocery stores, meat packing, food processing, warehouses, distribution, retail shops, and some other industries. Our members help put food on the nation's table and serve customers in all 50 states, including Canada and Puerto Rico. Me personally, I work with Local 700 here. Yes, mostly Indiana, Daniel, with a little bit of Michigan, Ohio, and Illinois, but mostly Indiana. And this is where our members are and have been on the front line of this crisis. And our members continue to serve the public at great risk to themselves and to their families. Worker safety has always been our highest priority in our union. Our union has been able to work cooperatively to implement in our facilities many safety protocols, including social distancing, restricting access, temperature checks, modified time off, facial coverings, additional sanitation procedures, and some improved worker communication. Now, keeping our community safe requires strong action from our elected officials here in Indiana and in Congress, along with the leadership from the private sector. And our union has been fighting our elected leaders to designate grocery and food workers as first responders. They need to be recognized for their vital service to our communities and ensure that they have essential protections they need to keep them and their families safe, like increased access to affordable childcare. I know we have touched a little bit on that tonight. We need free testing for any worker exhibiting COVID-19 symptoms. And we need better access to PPE, and we need presumptive coverage for COVID-19 as an occupational disease. Around, I think, June 15th, our international president announced that we had 3 new initiatives in response to the growing COVID-19 cases across the country. One was to reinstate the hazard pay, establish a $15 an hour wage increase also for all frontline workers. We need to establish a public mask mandate for all 50 states and create a national registry to track COVID-19 infections on these frontline workers. In about the first 100 days of COVID-19, our union as a whole lost 239 members, and close to 29,000 members were infected or exposed. These are all members who work to support themselves and their families, and who work to help families in our community get essential food and supplies that they need. Our state and federal leaders must do more to protect critical workers because of the important role that they play in ensuring our food supply. So this pandemic is far from over. This is still an incredibly difficult time for everyone, but we must protect our essential workers in our community. Thank you.
Thank you, Karen. And now we'll turn to Milton Smith, the home health care aide on the panel. Milton, take it away.
First of all, thank you, Daniel, and everyone else for having me today. Thank you guys for taking your time out today to listen to us. Like Daniel said, my name is Milton Smith, and I'm a home care worker at Help at Home. I've been employed with Help at Home since 2016 when I was living in South Bend. So yes, you are right, I'm a South Bend native, and I transferred to the Indianapolis metro area. I love my job and I love the people that I've met along the way, and I'm glad that I can provide, essential services such as activities of daily living, bathing, cooking, cleaning, all those things that are deemed necessary for people to survive. But even during the pandemic, we are still providing these services to people. Oftentimes, people who live in crowded spaces where transmission and infection is easily spread. And so we're fighting for better wages here in Indiana with the union. Even though we care for others, we oftentimes don't make enough to feed our families. And so I'm a single male, but my industry is predominantly female, about 87%, and half of those people are women of color. So whereas I don't have anybody that I'm necessarily accountable for, a lot of women who are working in this field, are taking care of 2, 3, or 4 kids, sometimes often by themselves on poverty level wages. Home care is growing at a rapid rate, but it remains marred by those wages. And with wages being so low, there's been sort of extreme implications that's gone beyond the workers and their families and jeopardizing critical services. People often having to get gain supplemental income from somewhere, or that's what's contributed to the high turnover in our industry as well. Just as more and more Americans are becoming to rely on home care services versus traditional nursing homes and such. And so I believe that if we can get a living wage, that'll greatly help eliminate some of those problems. And as we continue to provide these services for our clients, I think that we should be getting essential worker pay to reflect our essential services, and that should be reflected in the federal wages. We've been left out of federal protections for years, dating all the way back to the 1930s when we were left out of the Federal Labor Standards Act that provided overtime protections and a minimum wage, federal anti-discrimination and sexual harassment protections. And so we continue to be left out of those. And so we're fighting to get more of those codified into law. And since the beginning of the pandemic, those who have worked in home care have continued to go to work and provide services for clients, all the while putting themselves and their families member in harm's way, even though despite a lot of people are earning the same wages and aren't getting any sort of pandemic premium. And then it puts you in a kind of a cycle, because with that also comes insurance that's unaffordable. So a lot of people are provided company insurance that has a high cost, but little medical benefits with a high deductible. So that's a very stark reality. So if you get sick and go to the hospital, oftentimes you're left with a big medical bill that you have to worry about on top of worry about getting sick in the first place and possibly dying from the virus. And so a lot of people with limited financial security, many of us work in the homes, and we feel like we have no choice to continue working with the hazards that comes with being in the thick of a pandemic, also with the fear in the back of our minds that we're exposing our loved ones and the people we care about to the virus. And that's pretty much all I got to say. I know there's going to be time for questions, so at the end, but that's pretty much the end of my spiel.
Thank you very much, Milton. Our final speaker is Robin Vida from our county health department. Maybe we should take a question now and go back to Robin in a minute. Or Robin, are you ready to speak on the panel? Okay. Oh, 1 minute, she says. Okay, so Katie, maybe we could go to a question before we go back to Robin.
Sure. So one of the questions that came in was, what role should the state be paying in getting hazard and care pay, and can we raise the minimum wage?
Yeah, so David, what can you say about the role of the state in any of these questions, and whether it's doing stuff we don't know or should be doing stuff that, you know, I know it's a challenge with the advocates for raising Indiana's minimum wage in a distinct minority in our, what I would call strictly gerrymandered state representation. But could you talk to us about what we can be promoting the state to do and what you folks are trying to do in particular about some of these questions?
Sure. You know, I think I think that it's still going to be very difficult moving forward because of what we're going to hear from the majorities. And we know that it's also true that there is going to be a huge loss of dollars that we're going to be faced with. But on the other side of it, I hate to use the words seize the moment, because the moment is a global pandemic, but it goes back to the words of, you know, Michael Higgins. The reality is what we're facing right now is something that we haven't faced in 100 years. None of us really know how this is going to move forward, but I think, and that's what I was speaking to in terms of hazard pay. You know, I know that some employers have done some things. I don't know to what extent in this state, but I think more so, I think we've got to look at it more long term, because this is not going to be a short term thing. It's just not going to be done and over with in 6 months or maybe even a year from now, where we're going to still be facing the repercussions of everything that's going to cause. So I do think we've got to look at it more in terms of fair pay, and so then that is discussing in terms of the minimum wage. I think this is a time that we have the opportunity to talk about the workers that are out there every day, and just like I believe it was Karen that spoke to how many members already they've lost. You know, people can face these things every day, but they haven't faced them in such a huge so many people that have gotten sick or have died, or that have died in such a short period of time. So I think that we do have the opportunity that we will be able to speak much more stronger about lifting the minimum wage. Some of the arguments that I've heard before, and I'll try to be short. Most of the time I think I succeed, but sometimes you don't realize you're kind of caught up on what you're saying. But most of the arguments we've heard before, well, we can't possibly raise that wage. You'll put us out of business. It's if I had to raise my cost for a cup of coffee and nickel, I'd be out of business. I mean, you've heard all type of different things like that. But I think that the argument is going to be there, and it's going to be much stronger that how to go about this. I've thought about this in terms of when people use those kind of arguments, they want to say that, you know, that we can't possibly do this, or that you can't bring in entry level people and pay them $15 an hour. Well, you know, I've mentioned it a few times that maybe we could look at like a tiered minimum wage, so that if an employer, if most people say, well, we're already paying more than that, that's not really the case for a great many people. So, you know, maybe you start them at this wage, a certain wage, and if they're going to work and continue working for you and become profitable for your company, there ought to be a next phase to where those workers are provided another higher tiered wage. And from that point, move on again for a period of time that they are engaged with these employers, that they move into a living wage, and not over a period of like 5 years. I mean, over a period, if you've got a worker and you've got them a couple of years, you pretty much know, whether that person is going to be a very good employee that has the possibility of becoming a long-term employee. So I've tried to think more in terms of maybe trying to approach from that. There's so many different things when you come with the exact same argument or the same way of doing things. We are still faced with the majority. I don't know what we're going to face after November, but I don't, in terms of the Senate, I think that we have an opportunity to maybe pick up a couple seats, but we're probably still going to be in the minority. The House is very possible that they could move from a quorum-proof minority so that they will have their voice. They can utilize it in a stronger way where they can capitalize upon maybe having media listen more, just by not necessarily leaving for an extended period of time, but extending the days so that they have time to talk with the media and present their case. Wow. So, again, too, it's going to have to be community input. And I know that we're talking about these things all across the state. We need to use our voices. I need your voices. We've got to, what we're doing here tonight, this is awesome right now. I'm seeing 62 participants and it's being recorded. I can only see this is growing because it's unfortunately, this is not passing us by this moment. The numbers are rising, and unless, I'll finish. The governor, at least it was somewhat assuring to the extent he maintained 4.5 again today, and he's going to do that for at least the next couple of weeks. He was asked questions about no excuse absentee voting, and although it doesn't sound like he wants to go that direction again, if I had to surmise, it does appear that he left that open. I don't know in reality how it's possible with our schools and everything else we're facing, how they can want to take that responsibility if things really do start escalating more. It appeared that he was going to be open to making stronger decisions. So we have this time where we cannot relent on wanting to do the things we need to do for those workers that are so important, and they deserve that respect and they deserve our help. And I'm open to work higher minimum wage and going further. I'll stop. Sorry.
Sure. Thanks. Thank you, Senator Niezgodski. So perhaps even if numbers aren't necessarily changing, the sort of climate and the context and the ability to voice on behalf of essential workers, the moral context may have changed for some, and maybe
Yes.
we can look for that.
And even some of the majority members, they're not all walk in step. And many times that'd be the way, but when you said moral, that's exactly what we're facing right now.
Good.
And I'm hard pressed to believe that people are not going to see that more so than they have in the past.
Thank you very much. I think Robin Vida is available for, we saw you busy at work, Robin, so thank you for coming in. We got to unmute you. There you
Perfect.
go. All right.
Yes,
so
and my apologies.
County Health Department. Go ahead. Thanks.
Yes, thank you again. My apologies. We were finishing up a very active Board of Health meeting, and those sometimes they go really long and sometimes they don't go nearly as long, but tonight we had discussion on a public resolution on racism as a public health concern and some actions that the Department of Health is going to take forth in the next year to not only address racism, I think, but more importantly, inequities that exist. So the constant talk that I have been hearing, luckily I was able to hear most of the conversation in one ear while listening with my other ear to the other conversation, bodes very well to our essential workers. And I think it will speak to the disproportionality of the COVID-19 pandemic, since most of our essential workers are those of minority status, which therefore do not have the same abilities to take off of work and stay home when sick and provide for extra childcare and those types of things. I believe, so my role is Dan mentioned, I'm currently our Director of HOPE, so Health Outreach, Promotion, Education. I've been here at the department for almost 13 years. I have a master's in public health, and I serve as a core function within the Department of Health day to day, but even more so with our COVID-19 response. From working all of the media inquiries that come into our department to pushing out social media messages, our website, working with employers on reopening guidance and COVID prevention plans, to I guess being a mom of two very small little children, while balancing all of these things. And we've been heavily involved with school reopenings, all amongst, well, I just reported today our highest 7-day rolling average of new cases since the beginning of the pandemic. So I would be doing my department an unjust service if I did not talk briefly about our current public health order that is in existence currently until September 7th. That is the use of a facial covering to protect not just one's self, but more importantly, the people one would interact with when unable to be physically distant in any sort of enclosed or even outside space. There's been lots of conversation around businesses that are not necessarily in compliance. We're not looking to fund patrons who choose not to wear the mask or whichever it may be, but really looking at businesses not taking the steps that they need to protect their employees. And we've been working on an ordinance which we were hoping we would never get to that point. But unfortunately, we have received enough complaints from enough employees to say, I've asked my employer to provide me with appropriate PPE or to wear my mask, and they have asked me to not do that, and or someone saying they say they're doing this, but in reality, they're really not. And the unfortunate side is, unless we can get COVID-19 under control, and that starts with transmission of the virus, we will keep repeating our mistakes and need to continue closing down and opening up, closing down and opening up. So if we could really just get it right for the next 6 weeks, we could really see some improvement, I think, in really staying at work and staying in kids going to school. And there wouldn't be this moment of concern. My oldest little guy would be going into kindergarten this fall. So talk about a difficult spot, a rock and a hard place, right? A public health professional having to send her child to kindergarten. So knowing everything there's possibly to know, and then also being a mom and trying to decide what I would want for my little one. So it really it speaks to the larger concern, and I think a lot of the conversation prior has alluded to this macro level concern of individuals as a whole, or a community as a whole, really doing things to protect not just workers, but protecting workers' rights, the ability for fair pay. I think paid leave. I think if I can think of one opportunity during crisis, as I'm really hoping that we can elevate the conversation around the inequities that our workers have across the spectrum, and really begin to move forward and see that these were issues that happened before a pandemic. And now these are issues that we're going to have to address because they've just been made worse across the world now. So I'm hopeful to answer any questions. I'm sure someone's going to ask around, what if somebody tests positive? What do I do? And, I'm sure someone's going to talk about the mask order and all those types of things. So really, I'm here to offer my best assistance and really, I think, be a resource for all of you on the call and any of your colleagues here locally So I do intersect with Dr. Mark Fox and Dr. Bob Einters, both of our health officer and our deputy health officer, daily, even on the weekends, to make sure that we're doing the best we can do. We're a small department. We have about 50 employees caring for 271,000 people, doing our best to keep everyone safe and making very hard decisions, especially in the eye of not knowing everything we've learned about SARS-CoV-2, the virus that causes COVID-19 infection. We've learned literally in the last 6 months. So when people compare it to the flu or influenza pandemic of 1918, no, we've been able to look at those, specifically the influenza pandemic now for 100 years. COVID-19, we haven't had that ability. So I appreciate those that support our efforts, and understand that we can do the best we can do until we know better. And then once we know better, we do better. And I'm hopeful that I will be able to answer those. I see one question that just popped up right now, and Dan, if it's okay, I'd like to address it. So a county mask order would force the sheriff to respond to violation calls, correct? And actually the answer is no. So the only one who's able to enforce public health orders is the local Department of Health. And that is given to us by state law, and is provided to Dr. Einters, our public health officer, since he is our county's public health authority. Now in the event where there would be a concern around safety, specifically if somebody was disgruntled or angry about being asked to wear a mask, in that event, yes, the sheriff, as well as both of our city police departments, would respond to that type of inquiry, but they will not respond to a patron who is not wearing a mask or to a business who's not enforcing the rule. That is a complaint that would come directly to us, and we have a team of individuals that go out and substantiate those complaints as well as offer assistance and advice. The drawback right now is where we come with the ordinance that potentially will go, I shouldn't say potentially, it is going to go forward to at least county council committee, would look at fining businesses, which is something we do not want to do. But we have had businesses blatantly tell us that they're not going to enforce our public health order. And here we're home rule. So county kind of trumps most of the other things, and we have to. So when we have a business that says, well, really it's recommended by the Department of Health, I'm pretty sure our public health order states it's required. So we've been trying to work on educating, ensuring access to proper PPE, and really make sure that the health and well-being of our community is at the forefront of our minds, as well as we know what we can do to best help each other.
All right, Robin, thanks very much. And I know you've been very busy, the whole county health department, so we really appreciate your work. There's lots of questions now, which is great, and I'm going to turn it over to Katie. It sounds, and I just want to say that we've got city councilors on this call. We have county board members. We have trade union presidents and officers. We have I know somebody from the Chamber of Commerce. There's a wide variety of people on this call, and I think that's great. So hopefully we'll get to as many of your questions as we can over the next half hour. So Katie, can you get us to the first question?
Sure. Yeah, so we have our first question from Melissa Gard. So Melissa, if you're still on, I know she said she had to jump off early. If you're still on, you. And you should get a pop-up on your screen when it's on.
Hi, thanks. Well, now I have about 100 questions, but that's okay. I think one thing that we've noticed is that the pandemic it's like a giant magnifying glass that's magnified all the cracks in our wall, right? And this is what we're talking about tonight is absolutely vital. And at first I want to say thank you so much for pulling this together, folks, and starting this discussion. I work for a workforce development agency. And so we see a lot of things. And I think one of my big concerns is we talk a lot about wages. And I think that's very important for essential workers and to elevate our frontline workers to that status. It also includes employment supports, and I'm maybe even more concerned about that. People can get jobs, but can they keep jobs? And I think that's a huge issue that we see from our end, having to do with employment supports, things that go as deep as healthcare, insurance, affordable insurance without those huge deductibles and so forth, affordable childcare, accessible childcare, transportation, all those employment supports that have been the issues all along, but now paid time off. Thank you, Robin, for bringing that up. Paid leave. That's a huge concern right now. I think it's time for a lot of employers to take a look at their PTO policies, their paid leave policies in these times. So my question is about that. What can we do? Where do we start to begin to look at providing those employment supports for people? And thank you.
And maybe in the spirit of like encouraging all the panelists might not feel they have answers to everything, but I am curious, especially those on the front lines, if in response to that question, if you've noticed any cracks. Melissa talked about the COVID showing cracks magnified in our society, but have there been cracks in any of the resistance maybe to improving wages, improving conditions, recognizing the essentialness of your labor? I'm curious if there's been any signs of movement there. So any of our panelists want to speak to this important question?
I think at first there was a lot of let's do something extra for the workers. I've seen a little pullback on that now. I think now they realize that this pandemic is going to be around for quite a while, and I think they pulled back on that a little bit, at least with some of my members. Another thing I think maybe which is hard is the mental health issues with working with COVID-19. And a lot of them just need time off also, maybe to take care of members, and that's unpaid. So they really do need some paid time off. And that would help them out tremendously. I agree with that.
SEIU, we shut down March 23rd. And anyone that volunteered to come in, because you still have professors and they still had to leave some labs open for students to come who didn't have Wi-Fi, couldn't afford it, whatever. They were paying us time and a half, but when the July 1st came, they brought everybody back. That stopped. And we're still there cleaning, and we're still there with the pandemic. So we did put in a request to continue to get paid. We haven't heard anything back.
Yeah, but it's sort of trying to leverage these temporary moves and make them not gifts from the employer, but new sort of secured rights or entitlements on behalf of the workers would be great. I think Senator Niezgodski, were you going to say something?
Yeah, I was just going to say that we know, and that's what has made so much of this so more difficult, because we have so little guidance from the federal government. We know that OSHA and the CDC has just recommended policies, so they have nothing that is really impacting or mandated. I think, in terms of with Indiana, that's one of the things we're going to have to work for, is to get our IOSHA to step up more, because I don't think they're going out and they're not issuing violations. We can definitely do more on that front. I'm really concerned that we are stepping into what everyone else had been talking about and feared. We saw what happened in Italy and some of these other countries, and it's almost like there's no turning back. We cannot turn our heads like some want to do and just say, well, just let's wait a little longer, it's going to be gone. We're going to be facing a lot. Unfortunately, I think we're going to be facing a much greater crisis. And again, that's going to cause us to be able to step up and say, we have got to do more.
Okay, thanks, Melissa, for that great question. Katie, how about another question?
Yeah, so we've got Kate Lee has a question, so I'm going to go ahead and unmute her.
Kate, and if folks can, like Melissa did, identify themselves so that people know who, sort of what you do would be helpful. Thanks, Kate.
Hi, I'm Kate Lee. I am the executive, what's my title? Executive Director of Education and Workforce at the Chamber. So education and workforce related projects. So the question I put into the chat was about pay. And it's a question I've been asking myself a lot during this whole time. I've sat in meetings since I started my work. And whenever the subject of high demand, low wage job came up, you could hear a pin drop in the room when you'd say, well, what about that? If it's that high demand, why is it low wage, right? Mm-hmm. So my question is does our pay reflect the value of the work or the value we place on those people that are doing that work? And how do businesses determine their pay ranges from entry level to top level? So this is for an economist, not me. I have a journalism degree. But how do we incentivize employers to make their ranges more equitable and reflective of the true value of the work and how it generates revenue for that business? It's kind of a big question.
Big, important question. I don't know if any of the panelists feel they can address that. I'm going to ask Kate in the chamber to start addressing that. That sounds like a great project for you all, and we can help. But go ahead, Milton. Sorry, Milton.
Well, kind of to answer that question, I believe ultimately what companies decide they want to pay us is driven by financial revenue and capitalist motives. And so I think the value of our work is important, but any corporation or any company is going to try to pay you less for doing the most. And I think that's when the state and the federal government kind of needs to come in and take a part in regulating those wages, because I don't think that, even though it should be incumbent upon these corporations, I don't think that they have the incentive to want to raise wages, because if people are going to work for those wages, and some people, don't have, and I want to say this in the least insulting way, but a lot of people don't have a lot of other transferable skills. They're kind of stuck in this quandary of, well, I gotta work, this is what I know how to do, and if I'm going to do it, my company isn't going to pay me. So I think it's going to take government kind of stepping in and doing something about it.
Thanks, Milton. I think, Kate, you raised a great question. There, I've been reading a lot lately on this problem of monopsony, the sort of a small number of large employers dominating labor markets and having the ability, in the absence of regulation, to be able to sort of control wages. And even in a tight labor market, you're asking, it's kind of a quandary why with such low unemployment we were seeing before March, why wages weren't rising way more significantly than they were. But I hope that we can continue to have a conversation about that. That's a great one. Katie, another question for us?
Sure. So we have a question from Lori Heyman. So I'm going to go ahead and unmute her.
City Councilor, Common Councilor, Ms. Heyman. Great to have you on the call. I can see you've been participating actively in the group chat, so we can hear your voice now.
Mm-hmm.
Is she unmuted, Katie?
There should be a pop-up on your screen when you get, okay, it looks like she's now.
Okay, good. As someone else just said, I have a whole host of questions, but when I found out that you had someone on the panel today that was talking about the food processing industry and labor, there was a report today that came out about how the president is using his ability to use executive order to declare certain industries to be essential, thus the workers are essential, thus have no ability to determine for themselves if it is safe for them and for their families for them to attend work. And there are large numbers of individuals, predominantly, at least in the report I heard today around the chicken industry, where there have been deaths that have actually not been reported to the rest of the employees so that people would not get frightened and decide not to come to work. And there's also the issue with the unions. We have, and I cannot remember the formal name of the Federal Labor Union Council, but they're working 2 individuals short, and it is not a bipartisan board at this time. We have 3 Republican representatives, and so they're working diligently to just tear apart the food processing unions at this point. And this all happens while we're all scattering, just trying to survive, and we're not aware of what's happening in Washington a lot of times, and it's affecting the people right around us. So I just think that it's important that we're having this conversation about the workers, and so many more, as many have mentioned today, are actually essential workers and get no notice or no acknowledgement of the fact that their work is so essential.
So Karen, maybe you can field that question. I know that Logansport has is it a chicken processing plant that?
No, it's a pork. That's a pork.
That's pork.
But the federal agency she was talking about is the National Labor Relations Board. That is a 5-person board, and presently there's only 3 people on that board, happen to be all Republican. So there are 2 seats open. So you can about imagine some of the decisions that they are handing down presently. Most are not favorable to unions, and this is very disturbing. People are losing rights, and on the Tyson plant in Logansport, that was considered essential. About 2,000 people work in that plant. At one point, I believe it was 1,300 people tested positive. And out of 1,300, 900 showed no symptoms whatsoever. They were, of course, ordered. I think they shut down for a short amount of time. Then they were ordered to go back to work. I don't think people understand that most people that work in plants are in close proximity to each other. And that's why the COVID-19 spreads so easy. And this is with face masks and some other PPE. It was a bad place to work at one point. But I think things have gotten somewhat better, but not totally. In this particular plant, we did lose 4 people. 4 people have passed away since March.
So do you think overall, Karen, that meat processing plants are seeing improvements? Or, I mean, OSHA, the Occupational Safety and Health Administration, all the reports I'm seeing are that it's basically absent in terms of doing.
Yeah, they're not really out there. They haven't really said a whole lot. I think that there is still a lot of infection going on. Probably not quite as much as when it first broke out, but there still are. It's just like I said, they work so close to each other that is how it spreads so easily in these plants. They weren't really, and touching back on the other question, they weren't really given a choice, whether they wanted to, if they wanted to work in that kind of condition. They were just all ordered back to work, no matter what. And that was the sad part. They were ordered back to work, no matter what the working conditions were at that time. So since then, some things have improved. And that's mostly, I would say, probably with the union. But there's a lot of non-union packing plants out there. And those are really bad too.
Thank you, Karen. And thanks, Lori, for your question. Katie, how about another question?
Sure. So we've got Shalene with a question.
Shalene.
Hello. Hi, Professor Graff. I'm Shalene. I'm a class of 2020. Notre Dame alumna, and I guess I should say what I'm doing next. So I haven't told you, Professor Graff, but I'm going to be working as a 10th grade chemistry teacher. Yeah, so anyway, my question, I don't even remember exactly because I, like everyone else, have a lot of questions. But my question was around the use of essential. So for 400 years, particularly for like as me, as a Black woman, like Black and brown people have worked and been essential, like on their backs have been the reason why America has prospered. And during the COVID-19 pandemic, you see that the majority of people on the front lines are brown and Black. And yet now, for the first time, we're like claiming people, oh, frontline workers, we should be appreciative of them. We should be praising them. But in that same light, essential means, if you're gonna, I looked it up in Merriam-Webster, being of the utmost importance. So if you're gonna claim people to be essential, then why aren't like wages such a priority? Like why, like my question is like around like, when will workers on the front lines actually be essential? Like when will violations be mandated or like mask laws be imposed for the protection of our essential workers? I forget who brought up the fact of like mental health, but that's particularly on my mind with essential workers. Every day you're constantly battling COVID, and at some point humans get tired. So yeah, that's just my question.
Thanks, Charlene. Does anybody want to tackle that on the panel?
I would just want to offer that time is going to happen. I know the things we're up against are large corporations and their ability to pretty much determine how they're going to want to set wages. But you know what? Hopefully this won't come to a much greater loss. But when people begin to realize that they would have to pay less unemployment insurance, they'd have to pay less in their workers' comp claims, they'd have to worry less about employees not coming to work because they're sick. You know, when they really get it through their heads that they're already paying those dollars, and they just it's just nothing else but a matter of respect. When they learn to just respect. You know, when they call upon and say those workers have to be on that site because they've got to do that, you know, we need to start calling them out much more and just expressing how little that they have shown in any kind of sentiment toward those workers. They're not just they're just not widgets, you know, that appear and are disposable. They are not. We're people. And it's time we were recognized. Those are the things that we have the opportunity to do, and it's not seizing upon these moments, but it's reality. And if more people can't see reality, then shame on them.
Anybody else from the panel? It's a big question on, I don't know, Brenda or Milton or Karen or Robin, anything?
Well, you know, she asked, you know, there's, like if workers are so essential, why can't we get paid more? And I get that question a lot. And it's simply something I call profit before people, unfortunately. And it's not going to change until there's enough of an uproar and the companies take notice and get something done. And that's what it is in a nutshell.
I wonder if there is a space now where the public consciousness has been raised to a certain degree. At least we're using the rhetoric of essential workers, and if we could leverage that into public shaming campaigns or public encouragement campaigns. I mean, I will say that I don't see this enough, but I went to my favorite local watering holes website to see the status of that, whether they're open, whether they're doing carry out. And this local establishment, I guess I can say the name. I don't know if it's, you know, I hope it's true what they're saying, but Crooked U it says right on their homepage, paid leave to any staff unable to work due to COVID-19. And, you know, that's not required by law, right? But it would be great to see more of things like that happening, and businesses, employers who are offering things that aren't necessarily required being commended for it.
Yep.
Yeah, so Milton or Brenda or Robin, anything to add on this central question? Or
You is paying you. If you have to go get tested, if you're off for COVID, they are paying.
So IU as an employer is stepping up like they should.
Oh yeah.
That's
yeah.
good.
I mean, we're not paid enough.
Milton said he's muted. There we go. Hi, Milton, you're unmuted.
Okay. No, I didn't really have anything to add at that particular point. I wasn't muted, so.
That's fine. I thought you were going to say, let's meet at the Crooked U. But Katie, how about another question?
Yeah, so our next question is from Hannah Stowe.
Hannah, please identify yourself too.
Hi, my name is Hannah Stowe. I'm a member of the Community Forum for Economic Justice, South Bend native, and I currently work from home and raising my little boy. But I used to work sort of proximate to the home health care field, so I have a couple questions about that. And the first one, I guess, was kind of a leading question to Milton, maybe more of a statement, just because I know that it used to be true when I had familiarity with that field, which is that a lot of the workers, because of the low wages, were forced to have multiple jobs, sometimes work for multiple different clients in their homes or work for multiple different companies providing the same service. And so, you know, when they got off of one shift, would be traveling, you know, to another client to take care of them. And so, you know, just kind of, again, it was a leading question, but just wanting to raise awareness to the fact that, you know, because of the low wages, the risk of transmission, like during a pandemic like this, is even more amplified. And so Milton, I was wondering if that's been your experience with your coworkers. And then also on the home health care side, the provider that I used to work for, I remember at one time when they did cut the pay for direct support professionals, the justification that was given was that Medicaid had actually lowered the rate that they would reimburse providers for those services. So there is like some kind of correlation there, and I was just wondering if David could speak at all on, you know, how much power the state has to control that, if there's anything on the table as far as raising the reimbursement rate for these essential services at this time.
So Milton first, and then Senator Niezgodski, maybe?
Okay, yeah, what Hannah said is very much true. You often, like, people have people with a heavy caseload. So right now I actually went on leave from work, and I'm getting ready to go back in August. I had a client that had a COVID outbreak in her building. And like I was saying earlier, a lot of clients live in these close quarters. And so it makes transmission that much. I couldn't put, I think your question, I saw it in the chat, was asking how many coworkers would I estimate, and I couldn't put an exact number on it, but I know a good majority of coworkers sometimes see 5 or 6 clients in a day, 5 days a week. And so my particular company, Help at Home, is kind of divided into 3 different branches. You have the skills side, then you have the direct support professionals, like she said, the people that do run errands and do more like companion type of visits. And then you have the developmental disability side, where people work in group homes. And I actually had a fellow coworker and union member get sick in one of her houses, and she passed away, and she worked in a house with like 4 or 5 different clients that she had to attend to. And so that's why I was saying is, very real being in these kind of close quarters, that, you can transmit it. And if you're an asymptomatic carrier, you can bring that home to your family as well.
Thank you, Milton, for sharing that. That's sad, disturbing news. David, did you want to address
addressing the state reimbursement rate? I'm sorry that we were talking with in terms of unemployment.
No, Medicaid reimbursement, I think, because it impacts home health care wages.
We've had conversations over the last couple of years on this. You know, that's something that we're obviously going to have. We're going to have legislation on that. We're going to have to fight for that. And you know, it's hard for me to understand sometimes why certain members within the majority really can't see by raising some of those rates that they are going to be undoing some of the things that have caused so much harm that we deal with every day. And I've been in the legislature 14 years now. And when I first got there, I was there, and I was a part of the majority for the first 4 years. So I've gone through a lot of different, and I was part of Urbana with the right to work, and it was not just right to work, but it was just also education we were fighting for. But so I know how to fight aggressively. I know how to take a strong stand. But in the years as I've gone forward, going more and more in the minority, there have been things I've still been able to accomplish. And I don't think it's from standing up there and spouting off all the things that we must have. We've got to approach it from a way where, we're not assisting them because they're not doing it. But I just think it's in terms of thinking in a different way to where, we have to show. Right now, we can show these needs. We can show these needs with the public. We have to use the public in a way that we're all standing up and we're calling for these things because it's blatant. It's stark reality right now. And I just think that, it is almost a call to assistance. We don't always have to try to argue or fight our way to that, to getting something accomplished. We just have to speak our voices and make sure they're heard. And right now, public discourse or public input is going to go a very, very long way.
Okay, thank you. How about one more? We know there's lots of questions, and we're going to continue these conversations, and we're saving the chat. Some of us might follow up with individuals outside of this, but maybe we'll do one more question in the formal part, Katie, and then if folks do want to stick around, I'm happy to. I want to go ahead, though, before that and thank the panelists because they're all working full-time or more than that, and they're all extremely busy. I don't want them to feel the need to stay beyond 7:15. So but I just want to thank them for coming on. You're welcome to stay on, panelists, but there's no expectation. We know how to find you when we need to follow up. So, Katie, how about a final question in the formal part? And then we can continue informally too.
Sure. Yeah. So we have a question from Lori McGowan.
Hi, Lori.
Hi, Dan. Whoop.
We hear you.
You do hear me? Okay. Okay. This was a question for Senator Niezgodski about workers' comp insurance and a possibility of covering any kind of COVID-related illness as an occupational disease. I just wondered if the state insurance department or, if you're familiar with any committees, insurance committees, or if anybody's talking about that. I'm sorry I didn't introduce one. I'm a retired person now, and I retired from the library at Notre Dame, but for many years I worked for Wausau Insurance. So, and I was an account representative, so I sold workers' compensation to companies. And that seems to me that would be a way to cover medical costs as well as any kind of disability for time off work. And unfortunately, provide some compensation if a person were to lose a life from that. I'm sure it would be difficult, but I'm just curious, is anybody talking about that?
Well, I can't say anyone has directly talked about, actually there have been, but in terms of legislation, we haven't really had the opportunity to discuss that in a lot of detail. I can tell you with the Pensions and Labor Committee, I've sat on labor and employment, or pensions and labor, which is in the Senate since I've been in the legislature. Last year, the Senator Karen Talion had a bill that was trying to seek greater reimbursement on the workers' comp. What we were up against is that we're hearing that the costs, some of the costs have gone down, but yet you have the insurance companies and the hospitals and the doctors, they are still negotiating the rates. And sometimes we aren't the ones that are seeing anything different because they're just negotiating different rates. So adding COVID to this is something I know there has been some discussion, but you know, we're going to have to work on this legislation, and we're going to have to try to appeal to the greater sense of the acknowledgement that these things are not going to go away. And if someone is directly impacted off their job and they were infected with COVID-19, that should be one of the mechanisms where they can seek remedy.
Well, it seems like.
Lori, I'm gonna cut you off because Katie convinced me to allow one more questioner in. So we're gonna sneak one more in and hope that these important conversations about workers' comp, unemployment, Medicaid, everything else continues, obviously. But Katie, have one final question?
We had a question from Pam Butler, but
that's okay.
Okay.
Pam.
Yeah, I was going to say you can move on to someone else's, but this might be actually sort of an uplifting note to end on, maybe, or a really depressing one. I would love to hear from the folks who are representing unions here. What has changed for you in terms of what's possible in organizing? I've been thinking about, like, are people getting more politicized about their working conditions and you're able to move into workplaces that weren't previously organized? And things change in terms of how you're able to bargain with employers, or is it worse? I don't know. I just would love to hear your reflections on what has shifted for you in that landscape.
Well, the only thing I'm hearing right now that it's very hard to organize when you have to get one-on-one with a lot of people and talk with them. So there hasn't been a lot of organizing going on. Of the organizing that has been going on, of course, you know, we can talk about the advantages of being in a union that guarantee you, you know, your rights and your working conditions. A lot of the non-union places have no guarantees to these things. But that is also encouraging for people to hear that they got, of course, they have the say so, but then they got the guarantee of PPE and this and that, and that is attractive to them.
How about Milton or Brenda? Any thoughts on Pam's question?
So I know we've been doing with my union a lot of this Zoom meetings, just basically kind of activating like our core members, especially with the election coming up. It is hard to meet with new people because, you know, people are apprehensive about people showing up to their homes, and right now it's just quite frankly dangerous. But what we've been doing is kind of just activating a lot of our core members and, you know, telling them to tell a person to join, and doing it through education like that.
Brenda, any thoughts or? No?
We haven't really been doing anything.
Okay. Well, I mean, it is a challenging time, right? So on the one hand, you do see, say, unorganized workers, Amazon, Instacart. For a while, we were seeing lots of sort of actions happening. It seems to be quieter, and I don't know if that's because the media has moved on from covering worker agitation and organization. That's partly what I fear. And one of the reasons we wanted to do these kinds of meetings is because, you know, I consider news reporters essential workers too, and I've been relying on a lot of them, the South Bend Tribune, the local television news folks. They're stretched as well, and and have limited in terms of what they can cover, as well as, you know, perhaps guidance on what they should be covering. So we're not hearing a lot of these stories now as much as we were in April and May. I want to thank everyone, again, the panelists in particular, but everyone for coming in. And the final thing I'll say, we'll send out an email since you registered for this session to make sure you know about future sessions. And we hope you'll join us then. I'm hoping to do a next one in August. I did want to alert people to a new podcast that the Center for Social Concerns at Notre Dame is just launched. And I shared it in the chat, and I'll just share again the link. It's called Speaking of Dignity, Workers on the Front Lines and the Common Good. And these are short episodes where either Professor Margie File, a theologian who was on the call earlier, I don't know if she's still here, or myself or another one of our colleagues at the center interviews a worker about the work that they do. And if things have changed for the better or for the worse under this pandemic. But really, it's an attempt to give working people a chance to speak rather than be represented by others. But it's sort of in the spirit of Studs Terkel. Some of you may have heard of him, the oral historian, the journalist from Chicago who published a book called Working back in the 1970s, where he just talked to people about their work and it became a bestseller. So inspired by that spirit, we've undertaken this podcast. I think the first two episodes, we have an introductory episode where we lay out what we're doing, and then we do have our first two interviews. The hope is that every 2 weeks we will release a new one. Our first one is a local grocery store worker who preferred to remain anonymous. The second is a letter carrier named Sean Welcome, and those two are available at that website, and we'll be adding including one from Brenda coming up soon that we'll be recording shortly. So I encourage you to check that out and give us suggestions on people who would be interesting to interview. We're casting the net widely, so workers on the front lines can mean lots of things. Okay, and with that, again, the formal component is over. I'm happy to stick around if anybody wants to continue to talk for the next few minutes. And thanks again to Katie McCauley for fielding the questions, to Judy Benchar for doing some of the behind the scenes work, as well as some of my colleagues at the center and colleagues in the community who helped hatch this idea, some of whom couldn't make it tonight because of competing events. Yeah, thank you all.